commission from time to time. Mr. Paranoia.
Okay, and then we have Buzz coming on D, is that right?
We have Buzz coming on D, and that is another opportunity rebate program. Operation here in Amarillo should result in an additional 5 full-time employment equivalent positions that allow that business to keep growing.
Okay, E, Occupational Medical Services, OMSA.
Okay.
Yes.
Mayor, item E, we're asking for your approval of a non-exclusive contract to allow us the flexibility to, in addition to Concentra, use the Care Today clinics or Care Today urgent health clinics for certain of our occupational medical needs as listed here.
I know there's a new one on Georgia. I wonder how many are there?
That is a private practice.
On Georgia?
Yes.
Oh.
That's
Isn't
Cindy
it?
Hudson. Cindy Hudson. On Georgia, Peach Car Smart?
Uh-huh.
Yeah, that's Cindy Hudson.
Oh.
But it's part of the
Family. Mike Hughes.
Yeah, right.
Really?
I saw the logos always make that on that.
Their cars all over.
Yeah, it's because people still think it's a used car lot.
Oh.
Did you see the signs on the windows? They come up there and park.
Yeah.
We have a carnival-like atmosphere today.
I know.
We're joining in.
It's always good to enjoy our work.
I know.
We love it.
Okay, we have our health care and our dental plan and
Flex
Flexible,
benefit
yeah.
plan, and
Flexible.
Mayor, I would ask Mr. Fuego to come
Marcus, we don't
up, help us work our way through these.
If we have any real hard questions, Cindy's here.
Yeah,
She'll have
right.
the answers.
One leads to another, leads to another, so we
Right.
start with the healthcare benefit plan.
Okay.
Most of the changes we're making are to comply with the Healthcare Reform Act. On the main health plan, we're adding the 26-year-old dependent children if they don't have health insurance offered at their work. In 2014, we'll have to drop that requirement and just add them whether they have it or not. We made some other changes in the coverages. We added orthopedic shoes. Yeah, orthopedic shoes. Insulin pumps were added. So some minor tweaking of the plan.
But it to be in compliance with Obamacare.
Yeah, the main changes are that, yes. And then the dental plan, we changed it to kind of mirror the health plan. Dental is not an essential health benefit. Is that the term?
It's a voluntary plan, so it isn't.
Yeah, it doesn't come under the Healthcare Reform Act, but we did make some changes into it to make it consistent with the health plan. The flexible benefit plan, the big change there, 2014, it's capped at $2,500. Right now, we're allowing about $4,800. $4,550. Right now, the employees can exclude $4,550 from their income and use those monies to pay out of pocket or drug co-pays, etc.
Do we really fully explain that to the employees, because it's such a great opportunity?
We try. We talk about it every time I go out at open enrollment time.
Okay.
And we have a lot of employees who, about 700 that participate. It is a wonderful, it's great.
You know, it's like betting pass behind the line and buy the odds on a crap table. I mean, it's a no-brainer.
And very few of our employees were going past $2,500 anyway. So I don't think in 2014 will be a big change.
Can I ask you one other question? I've had a big rash lately in my office of people who are still getting their prescriptions and paying their copay when they could go to United and get all this stuff for $4.
At Walgreens sent us $10,
Yeah.
$2.
Some of them get it free.
Yeah, some of our
Some of you can get it free. Now,
Antibiotics.
are we set up to take advantage of those kind of things, or not really?
I do that
Since-
right. The clinic really
The clinic drives patients.
And I was at the doctor, and the doctor gave me a prescription and said, you need this one free at United. So,
Really?
you know, we did bring it up last year, the year before, when they started doing that,
Good.
telling them how to utilize it.
We were relieved that Dr. East didn't have a rash when he said he had to. Oh, it kind of scared me.
But most of the changes were related to the Healthcare Reform Act. We have it's a specialized area. We use an attorney that specializes in this to make those modifications. We should be in compliance, and we still have preserved our grandfather status so far.
And how much are this costing us to do all these changes?
Probably around $7,000.
Per person?
Oh, I thought the legal bill?
No.
I'm sorry.
You're talking about adding
These
26-year-olds, whatever we're doing.
That's probably the biggest cost, is adding.
Adding those dependents is going, you're adding that care, and we're not getting generally any income, because our plan is set up to be individual, spouse, children, or family. So if you have children or family, you can add another child without any increase in premium. So we'll get the claims, but not any premium income from it. I don't have an estimate of what it's going to cost.
Well, my question is, when does that go into effect on Obamacare?
January.
So why are we doing it now?
No, January of next year
Of 11?
is when you've got to have the 26-year-olds in the plan.
And then the
Even if
everything
they're
else.
covered elsewhere.
No,
No,
no, if they're covered elsewhere,
If it's offered.
if they're covered, or even if it's offered where they work, we can exclude them from our plan.
Until 2014, when that proviso itself goes away under Obamacare. Obamacare is being phased in over several years, different parts of it. So this is to bring us into compliance with the current, or what will be current January 11, that you must offer it.
And then it's going to be phased out.
And then that's going to go away, and what will replace it is, you just got to cover 26-year-olds. If they want to sign up and they're a dependent, they're on. Whether they have to pay what their work or not.
And they don't have to meet an IRS dependency test. That was my confusion when it first came out, was I thought they had to meet the IRS test of dependent, but the only test is just the relationship test.
So this gets you ready for the January 11 rule, and we'll be back in a few years for the January 14 rule.
Oh, there's a 12.
It probably is.
Yeah, we'll have other phases.
Point out to you in terms of cost, the dental plan costs the city nothing. It's totally sustained by employee premiums.
Right.
The flex plan costs you next to nothing, it's administrative costs. That's all employee contributions that fund that. So of those three, the only one that has any direct financial impact to speak of is the group health.
But it's expensive.
Do we have a provision in our group health that says if they have a spouse that is currently covered by the city plan, that has employment elsewhere and can be covered there,
House primary.
we can't include them in our plan?
That is not in the plan.
You can't
If
do
they're
that. You can
employees
say that they
here.
have to be a primary on their plan and they can be a secondary on our plan, which you're saying.
No,
And if it's offered at the other employer,
You have to
we
take
don't
that
offer.
first.
yeah,
And then they're still not signing up. You can't do that, but you can still sign up.
oh, really?
It's just secondary. It'd be better for them to be on that plan.
Yeah.
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 Well, but,
So they probably wouldn't take our plan, is what I'm saying, but they still
oh, I
get.
see what you're
To
saying.
answer your question, they're not excluded.
But you
So
can put that in.
are we even thinking in the terms of the employee paying any of this somewhere down the road? Is it always going to come out of the city pocket?
Changes in the co-pays or contributions, yes, we'll have to do it eventually, but you'll lose your grandfather status once you do it. Isn't that right, Cindy? The co-pays, deductibles, we will lose the and it will happen eventually. But this
I
year,
mean, are we just going to continue to raise taxes to pay for employees' health care? Is my question.
no.
Okay. There's other ways to pay for it.
And we have changed their employees' contributions, deductibles, and co-pays on a fairly regular basis.
Okay.
This year, we didn't want to dilute the 2% raise by giving with one hand and taking with the other.
And you didn't mean continue to raise taxes when you started to raise taxes, right?
Well, as this
Right,
healthcare
start,
goes
not
into
continue. Right.
place, you know, it's gonna cost more. So you're gonna have to do something, either.
Well, these changes will cost us, I don't, it'd be a guess. But we'll monitor it, and we'll see here.
And truly, I don't know that what's on the proposed list today with these phase-ins is what'll actually be there by the time we get to it.
So true.
We know we've got the one that comes in for 1/111. Every time I go to one of the classes on this, I leave, I think, knowing less than I did.
I know, that's
Yeah,
true.
it's
It's a good opportunity that this will be declared unconstitutional, it'll go away.
We're big pieces of it. The suit's not against it. It's not on the entirety.
No, there's just,
It's on the-
I'm aware of 3 different suits counting various aspects of it. What's the one they talked to me last week? Was the federal judge declaring the mandatory purchase provision unconstitutional.
And the Republicans are talking about starting with funding.
Yeah, you can
For
stop
those
something
reasons.
by unfunding it
Right.
easier than you can by repealing it.
Well, and part of the way they were gonna fund it was the Medicare changes, which, the reimbursement, which they have postponed, and probably will postpone. But we, after this, subject to your approval, will be in compliance for next year.
Great.
Thank you.
Thank you, that's all the way to the page. Any other questions? I know, Brian, you worked with them a lot, and
And we'd like to thank Dr. Reeves. He helped Dean and I out both quite substantially running through that plan,
Kind of update some of
pointing
the,
out some legacy things that we were able to take out, and what we needed to update to go forward. Appreciate that.
yeah.
It was fun reading because everybody else read it cover to cover.
Yeah. Right.
thank you all.
I know they did.
Thank you, thank you.
We know Brian that you mean?
Okay.
Okay, a license and hold harmless agreement.
Standard agreement, Mayor, brought to you all for your approval as it's a public right-of-way issue. This is for Amarillo National Bank over at Taylor and Northeast 7th. It's up here. Dedication and acceptance, we have some right-of-ways also coming to the city. This is out in the Hillside Terrace area.
Okay. I know that as we talked, you said there was a 1 or 2 items on your agenda that were open meeting. So I'd like to do those if we could, and instead of coming back, did you have a list that we wanted to this was?
That list was predominantly closed
It is
session
closed.
items. Buzz David, though, is
Yeah.
here if you want him to briefly speak to your small business interest rebate project.
Yes. Hi.
Hi.
How are you?
Christmas, everyone.
Merry Christmas.
Bring cookies.
They're on their way, I'm sure, but they will be before I leave. Excuse me, just getting over some throat stuff,
Yeah.
cold stuff. On the consent agenda today? Okay. We do have a project that the Amarillo EDC Board did take action on at our December meeting, and it is a small business interest rebate for Support Hose Plus Incorporated. Excuse me, if you're familiar with them, they are a provider of a number of compression stockings, supports, braces, and other orthopedic things of that nature. They are here in Amarillo on Bell Street. They probably do 98% of their sales of their products online. And what they are doing with our help, with your approval, is upgrading their website and their online ordering capability. They've got about 14 employees now. They're looking to add as many as 5 more over some time. The Small Business Interest Rebate Program is one we've used for quite a few years. It is a way to assist small businesses by providing a refund to them when they have already paid their financing for a project. And they show us documentation of payment of the principal and interest, and then we rebate the amount of interest up to $100,000, and in this case, up to 5 years. It's a good way of helping small businesses locally with zero interest financing. They do have their financing in place for their line of credit through Amarillo National Bank. And just a good local expansion.
I can remember touring that facility, and it seemed like they were almost out of room. That was like 2 years ago.
And they're floor to ceiling with their
Yeah.
inventory, that's for sure. But they move their inventory very quickly.
Where is this on Bell?
2300 South Shell.
You know where Sally's is? Sally's, yeah, okay, Albertsons, it's right around the corner there.
Oh, okay, on
And
that strip
building.
center that goes east and west,
Mhm.
okay.
Of course, the agreement that we use for this is a simple couple-page agreement, but it requires them to retain those positions and remain in business for a length of time more than we could delay that. Nice thing about this type of assistance program is it's always after they perform, after they pay, they submit their invoices demonstrating payment. And this is probably the 8th or 10th one. This is probably the 3rd or 4th company that has been a Enterprise Challenge winner previously, that come for some additional assistance to help them grow. Support it,
They do a lot of exporting, don't
They
they?
do.
Yes, it's amazing.
In fact, we were talking about it at the board meeting the other day, and Tom Evans had some of their hosts on.
He did?
So, yeah, they do have a small retail outlet. So, anyway. And it was not a John Namath style either.
That carnival like that.
Oh, that's great. He said fishnet.
Personal preference.
I know, that's true. That is true.
But,
Pass that on to Tom.
no other questions, I'll
No,
just
they're
wait.
good company.
Then we'll get to brief you on afterwards when we get executive
That's
session.
great. Okay.
Thanks.
Thank you so
Appreciate it.
much. Thank you.
Mayor, that does finish the agenda. If you'd like, we could move into closed session. I think we've got several items that we would need to cover there.
Okay.
Hopefully, the goal being we can get you all out of here on time today and not have to ask you to come back after the regular meeting.
Okay.
Sir.
I think y'all go get Coke or something, sandwiches. Thank you. Thank you so much. I don't know what I'd do in it.